It seemed like every day got hard for him to get through, and we knew he had a vulnerable immune system because we had taken out a key part of it, his spleen. So we were always kind of living in fear that we were blaming a fever on lymphoma, but it was really a sign of infection, and we had a lot of these, we'll come in and get checked out, let's prove to ourselves we're not dealing with infection. So unfortunately that went on for a couple months.
That's when she and her team determined that I was eligible for a state-of-the-art, which is a state-of-the-art procedure in the whole world, called CAR-T, C-A-R-T therapy.
We did the CAR-T procedure.
And now there's just this massive team of T cells that are now roaming around your body looking for cancer cells to attach to, burn up, and kill.
And it started off, the first week seemed like it was fine. And then we started seeing all the complications that we kind of counsel the patients and their families on. So we started seeing what we call that CRS, which is known as cytokine release syndrome. That is that surge of inflammation. So high fevers, low blood pressure, things like that. He actually went to the ICU temporarily for that, was able to come out, and then I actually was rounding on him as he was riding the exercise bike in the hospital. I said, we're good, this is wonderful. And then he started to get what we call the neurotoxicity.
They said I went completely downhill and I was non-responsive and I ended up in the ICU.
So he went from, I remember it clearly, a Sunday afternoon, riding his bike, us joking with him, to getting to the point where he was having trouble answering some simple questions, to just then outright getting obtunded and not being able to speak or converse with us. We had to send him back to the ICU, and basically he lost a solid 2 days of his life. He doesn't remember anything that happened.
I was told that I couldn't remember my name. I couldn't write on a straight line. I don't even have a memory of it. My wife came, thank God, and I remember her face looking at me, but I don't really, it was it was in my head that she's there, but I couldn't process it. So it really affected my brain and the rest of my body going through it. But that battling this whole year since April of last year, it's just you don't know if you're going to make it. It's a scary thing. I don't wish cancer upon anybody. I have a lot more compassion and empathy for those that get cancer, or really any major disease for that matter. It really changes your outlook on life.
We gave him high doses of steroids to counteract the inflammation that was hitting his brain. He fortunately did come out of that fairly quickly and came to and was able to be awake, alert, converse with us. And then about 2 to 3 days after that, he was fortunately able to leave the ICU and then was back on that exercise bike. And then about 3 to 4 days after that, we were able to get him out of the hospital. He has spent the 2 to 3 weeks out of the hospital kind of building his strength back up, just kind of getting back to some normalcy. And then that led him to kind of that first milestone we look for, which is what we call our day 30 or our 1 month assessment. In his case, he had a lot of lymphoma in his bone marrow, and he had a lot of lymphoma in his lymph nodes. So we did scans to look at the lymph nodes. We did a bone marrow biopsy to look there. And I was just able to call him Monday evening and tell him that both places showed no evidence of lymphoma.
How I felt when I found out that I was in complete remission was, I can't believe it. I didn't think this was possible. I feel ecstatic. I feel that I have a shot at life again.